It's exactly 12:36. Welcome back. Our final interview on the mid-morning show for today. We're going to be talking to a very dynamic and results-driven healthcare professional with over 20 years of experience in clinical nursing and, of course, also in operational management. She's also the NGO program leadership, currently serving as a project manager at TB HIV Care. And that's exactly what we're focusing on this morning, or this afternoon rather. We're going to be looking at World TB Day with Nomzamo Vali. As I indicated earlier, on project manager at TB HIV Care. Good afternoon. Welcome to the program.
Hey, good afternoon to you, Julie. How are you?
I'm very, very well indeed, and I understand that you're on the ground today. It's World TB Day, so lots happening. Many congratulations on all of your achievements. Your bio is really brilliant, but we don't have the time for me to share all of that with our listeners and viewers today. But let's just dive right in. What are the biggest challenges communities are currently facing when it comes to TB?
The challenges that the communities are facing when it comes to TB is the linkage to care and completion of treatment, of TB treatment. People are diagnosed with TB, but to get all of them on treatment, it's still very much a challenge because the completion rate for TB treatment in the Western Cape is currently sitting at 81%. And in South Africa as a country, we're sitting at 83%, meaning that there are people who are known to have TB that are roaming around and not on treatment. And a lot of community members are at risk of getting infected with TB because it is airborne and you cannot tell who has it. So anyone can just breathe it in. And also the psychosocial determinants of health, meaning that a lot of people are unemployed and they stay in congested areas, making the risk of contracting TB high. And when they do get TB, it's a matter of choosing whether the last 20 rand I have, if I'm unemployed, should I buy bread or should I go to the clinic? So the disengagement rates from treatment is very high. So that is what I see as a challenge in our communities.
So let's look at our communities in particular. What are the early signs of TB that people often ignore or misunderstand? Or is it deliberate on their part to ignore simply because there's still a stigma attached to TB?
There is still very much stigma attached to TB, and also lack of knowledge, and that is the big thing. Stigma is the big thing because they are ill informed, those that are living with TB and those that are in our communities that are supposed to support the patients. They don't know better. So it's a mixture of elements that causes that people are not adhering to treatment. But stigma is very rife, and lack of support from the communities. And I think that is why the theme for 2026, and it has been oncoming, last year was the same theme as well, to say, yes, you and me can end TB. So it needs a community approach. It needs a family support approach for us to be able to support those that are living with TB, and eventually we will be able to eradicate TB.
Nomzamo, you indicate I raised the question about stigma. Do you think it's the fear of being labeled that if you have TB, automatically you're going to present with HIV at some point and then AIDS? Is that the thinking amongst our people? And what is it that we ought to be doing, people like yourself and us as media, to try and break that stereotype, that misinformation around TB? Because TB doesn't necessarily have to equate into HIV or AIDS. If properly managed, the person doesn't have to progress to those levels. Would I be correct?
So let me just clear that up to say that TB does not progress to HIV. TB is a condition on its own, and it is one of the opportunistic infections that one can get when you are immunocompromised due to HIV. And there is that misconception that when you have TB, people are going to think you have HIV. And I just want to clear it that those are two different conditions. You can have TB without necessarily having HIV. And so, yes, that stigma of association of TB with HIV, it's the other reason that some people who does not want to be associated with TB, so they will rather not take treatment. But as the healthcare providers, and as the media, I think we should not be just doing this awareness only during March month, which is TB awareness month, because TB is present all the time, and there is high number of people that have been diagnosed with TB that did not take treatment. And so we've got a responsibility as the community, as healthcare providers, as the media, and as communities, government as well, to get together and make sure that we spread the word that TB is curable. Treatment is only 6 months, and when you don't treat TB, then you get to progress to the multi-drug resistant TB, or you can even have extremely resistant TB. So it becomes more costly when to treat someone that has not treated TB timeously. So we need to speak about the signs and symptoms, which is your weight loss and drenching night sweats, and that people, when even you have two of the signs of TB, you go for testing. And as soon as you are tested, be on treatment, and let us support those that have been diagnosed with TB.
Okay, let's go for an ad break. When we come back, we can talk some more on TB, which undoubtedly is very prevalent in our part of the world. Today, on World TB Day, we are talking with Nomzamo Vali, TB HIV Care Project Manager. We'll be back with you in a minute or two.
Searching for elite local and international investment and advisory services from an award-winning firm? Look no further than the Belmont Meyer Group, your gateway to unparalleled investment and wealth management. At Belmont Meyer, we believe in the art of wealth creation, a meticulous process fueled by our unwavering commitment to excellence. With a focus on providing elite alternative investments and quality advice, we also pride ourselves on maximizing value for our esteemed investors, as seen through our consistent outperformance. Your financial success is our top priority. Join us at Belmont Meyer and experience the difference firsthand. Ready to embark on a journey of greatness? Contact us today. Reach out to the Belmont Meyer Group on 078 786 1698. Call or WhatsApp or email us at info@belmontmayer.com. Elevate your financial future with Belmont Meyer, where every detail matters.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, consultations. Call now on 042 203 1400 or visit quantu.co.za. The Quantu Private Game Reserve, the place of gathering.
World-class financial services only at Sapphire Global, your financial partner. If you are looking for Islamic, Sharia, and ethical financial products, look no further. Sapphire Global offers a wide range of financial service offerings from short-term to life and investments. A full-service center with all financial requirements under one brand. Our highly skilled and experienced consultants are ready to help protect your financial future. Contact us on 041 001 0184 or visit our website on www.sapphireglobalfs.com. Sapphire Global is an authorized financial services provider.
Rejuvenating media day by day. This is Salam Media.
Welcome back. It's exactly 12:47. This is the Mid-Morning Show with me, Julie Ali. And of course, it is our final interview on this slot. We're talking with Nomzamo Vali, TB HIV Care Project Manager. Welcome back, Nomzamo. So I guess the all-important question is how accessible is TB testing and treatment in underserved communities? And do you believe that people, even though it might be accessible enough, would refuse to go to be tested? Firstly, for the fear of being tested positive. Secondly, for being labeled, and the stigma that goes with the labeling.
The testing services are readily available in the underserved communities because there are clinics that are treating TB and testing is free. And you also have organizations in the NGO space like TB HIV Care, and there are a whole lot of them that are funded by the Department of Health and other funders to be able to do and bring these services in the community for the people to be able to access them. However, the use or the uptake of these services, it is not what we envisage when we're putting these services in place, because people are reluctant because of the stigma to access the services, and also some people would rather not know what is wrong with them. So many a times we find patients that are very sick, and then they only will come to the services. And the other challenge is that TB does not present itself with coughing, persistent cough to everyone, because as it progresses, it can even move to outside of your lungs. It can be in your tummy, it can be in your brain, it can be in your bones, it can be anywhere. So because it presents itself in different ways and people are not so well informed, then people will not pitch for testing. And so the other issue is that when the people test, for example, in events like we are doing today, outreaches, we do outreaches also during the year, but when we have an outreach like a campaign like today for TB Day, people will come and they will not come necessarily for testing for TB, and we offer the test and they find out that they are positive, and then they still in denial, they are not ready to start treatment, or they will say, I didn't come here for that. So it's a challenge for us to be able to keep the patients on treatment, and also to market the TB testing. And we cannot stress that enough, that testing is very important, and once you know that you have TB, please get linked to treatment.
We talked a lot about stigma regarding TB, and also the the misinformation, the misunderstanding of linking TB with HIV. Why do you suppose there is that misunderstanding? And what can people like yourself, a healthcare professional, with these awareness campaigns do to demystify the whole issue around TB and to break it away completely from HIV?
Education, education, education. And we need not to use high level medical terms when we're explaining these things to patients. And we also need to assess the level of understanding of the patients, of the content that we are sharing with them, and be open to the questions of clarity from their side, empowering patients in terms of TB, and also the reassurance that TB is not HIV, and when you have it, actually treatment is shorter than when you take treatment for HIV. And strange enough, what we are seeing is that people that are living with HIV, they stay longer on treatment, even though it is a lifelong treatment. TB treatment is only 6 months, and people don't stay on treatment to complete it. And that is due to misinformation. And that is why we're embarking on these campaigns. And we're also having the IEC material, like the information leaflets. We have community health workers that do door to door visits to people's homes. We have the TAT nurses that are doing the TB screening. They go to schools, they go to workplaces, to make sure that people understand. And I think destigmatization will end when the people have got a better understanding of TB, what it is and what it is not. It is a bacterial infection and it is curable. HIV is a virus, and it's a lifelong condition up until we've got treatment for it, and those two are not the same. So we need to preach that to the patients and to the communities until they get that understanding. And the other thing that I found it works is to have people that have survived TB and they've taken treatment, successfully completed. Some even had the resistant TB and they used treatment to completion. So we have peer education, and let those people be the ones that will come and educate patients that are still starting the journey, just to have support system for them in place. And we are also looking at having some support groups within our community, and also, decanting the treatment from the facilities, that the patients don't have to wait in long queues, because they also get easily tired of waiting, long waiting in the facilities. They become very impatient. So just patient-centered kind of service is what we ought to do as healthcare providers, and then support them in their journey to completion.
So, Nomzamo, you indicated that the TB treatment only lasts for 6 months. Are you saying then, if a patient is fully compliant with treatment, that after 6 months, if their TB did present with coughing, the coughing will stop, they'll start gaining weight again, and they'll stop being as exhausted and as tired as they used to be in the early days of their TB diagnosis? What does that 6 month, post 6 month person or patient look like? And once you've cleared them of TB, I presume tests will be done, to swabs will be taken to say that you are now clean of TB, you don't have TB. What are the precautions they have to live with thereafter, after they've been cured? I'm sure there are precautions that they have to follow, protocols that they have to follow.
Okay, so the treatment they get, it is so good that even after 2 weeks of being on TB treatment, you already feel better. By the time they 2 months on treatment, they change to a different phase of treatment. By 6 months, they are well. So the precautionary measures, and that should apply actually to everyone, not only to people that have been diagnosed and completed TB treatment, is the basic like opening of the windows, and if you are coughing, covering your cough, and wear a mask, and continue to protect yourself, eat healthy, exercise. When you're feeling not well, go and seek help, get screened. Don't wait until you are too sick before you access the healthcare services. And because help is there, and we just struggle to get the buy-in from the patients. So just post the TB, life goes on. After 2 months, people are able to go back to work. They're not infectious. Even after 2 weeks of being on TB treatment, a person is no longer infectious. So mask wearing, opening of windows, eating healthy, drinking lots of water, protecting yourself. Because TB is airborne, you might get it again, and you might even get the resistant one. So just protect yourself. If you're coughing, wear a mask. If you cough, cover your cough, just like we did during COVID-19. And people can live healthy, long, healthy lives post the TB diagnosis and completion of treatment.
We're entering flu season now here in South Africa. Lots of us are already. I've been down with the flu for 1 or 2 days now, feeling quite miserable. People with flu, are they more at risk in contracting a TB, or what does it look like in terms of having a bad bout of flu? And if you're exposed to someone who has TB, are you at risk of then coming down with TB?
That is not necessarily the case because we all do get flu. Um, what determines whether a person will get TB or not is the level of the strength of your immunity, because all of us do have TB sitting in our lungs, even though we are not diagnosed with TB. It is called latent TB because there is a bug that is airborne and we are breathing it. When you don't know that the person sitting next to you has TB and you're not putting a mask, you're breathing it, and it lingers in the air, and it infects a whole lot of us. And so it might sit there, you will have your flu, and your body will be able to fight that off, and you are fine again. It doesn't necessarily mean that you are more at risk of getting TB just because you have flu. Flu happens. It's something different from TB. But the immune system that is depleted, that is a bit down, like when you have HIV, when you have diabetes, you might just pick up the TB. It can become now an infection. But flu, it is not an indication that you will have TB.
Okay, let's wrap up then. What message do you want every South African to understand about TB prevention and treatment?
I just want to say this message of yes, you and me can end TB. Let us take it to heart and make it each and every one of us responsibilities as South Africans, and more especially with the climate of the funding shortages in the country. Prevention is better than cure. So let us protect ourselves. Look after yourself. If you know your immune system is a bit on the low side, protect yourself. Put on your mask. If you have symptoms, go for testing. And if you test and you become positive, link yourself to treatment, access care, because it is available in the community, it is available in the facilities, and it is free in the government facilities. And as the community, let us support those family members or the people in our community that we know are living with TB. And there is also something called TB preventative therapy, TPT, which for those that have HIV, we put them on that to prevent them from getting TB because they are at risk of picking up TB. So just prevention is better than cure, and look after yourself, complete your treatment, and you can have a healthy life and carry on as if you never had TB before. So thank you so much.
It's exactly 1 o'clock, time for me to wrap up. Nomzamo Vali, Project Manager, TB HIV Care. Thank you indeed, bringing us awareness regarding World TB Day, which is today. Keep up the great work. God bless, and thank you for being with us.
Thank you so much. Bye.
And that's it from me. Thank you indeed for your company. Till next Monday at 8 o'clock on News and Views. I look forward to you joining me then. Have a great rest of the week. Take it easy and drive carefully. Till the next time, as always, Assalamu alaikum and Khoda Hafiz from me, Julie Ali.